Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from healthcare experts for your journey to Prime Health in both life and in business. Now, to pre-introduce our guest, I want you to think about this, that most people think regenerative medicine is about avoiding pain. But my guest today, Dr. Tammy Penhollow of Precision Regenerative Medicine, sees it differently. It's about preserving motion, protecting independence, and keeping people doing what they love without rushing into surgery. So if you've hit a crossroads in your care, I think this episode is definitely one you're going to want to listen to from start to finish. So before we jump into the episode itself, just a quick message from our sponsor, Grow Solutions, where health and wellness professionals discover how to double their impact and income without doubling their workload. Grow Solutions eliminate stressors in business such as new patient or client acquisitions, marketing and growth strategies, reducing operational chaos with proven frameworks, SOPs, and then also we help you understand AI systems and agents because the bots are coming for us whether we like it or not. Growth Solutions is not an agency or vendor. We are your growth partner. So if you've ever said this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we could be your solution. So drop the word grow below and either myself or team member will get back to you, or feel free to ping me on any of the social platforms that are. But you came here for a reason today, and that's to hear our amazing guests. So Dr. Penhollow, welcome to the Prime Health Podcast, and please do tell us a little bit about yourself and what you do.
Thank you, Dr. Barron. It is an honor to be here. I am an anesthesiologist and pain management physician by training. I actually quit traditional pain management back in 2015 when I discovered I was doing more bartering of procedures for prescriptions. And I was really only destroying joints with steroids or destroying nerves, which was decreasing the ability for the spine to remain stable because those nerves are responsible for feeding the big muscles that hold our spine erect. So I quit traditional pain management and said, the only way I'm coming back into this is in regenerative pain medicine. And with that, I found a whole new passion for being the osteopathic physician that I am, the whole integration of structure and function, and the ability to keep people out of the operating room and away from destructive procedures into constructive or building procedures.
Yeah. I can't imagine if you share that too often of a statement at a pain management seminar, you get a lot of friends and Christmas cards after that event, that are still staying into it. But I commend you for doing that. That's wonderful.
Absolutely. Yeah. It's what keeps me in the business.
Mm-hmm. Yeah, it's not easy business. People don't understand the difficulty, especially from a pain medicine standpoint, when there's a lot of medications that are involved and people aren't necessarily seeking for better health. They're just seeking for coverage of the pain. And I can understand it. Pain is pain, not a good thing. Yeah. So Dr. Penhollow, I do want to ask, I ask this of almost every single guest, was there a moment in your life, whether you were a little girl or at some point in time that said, you know what, I'm going to choose a path in medicine?
Actually, yes. I grew up on a little mini farm, 3 younger brothers. I call myself the firstborn son. We had everything from chickens to rabbits to sheep. We'd have the dairy cow across the street at the neighbors because they had a little bit more space. And from the 4th grade on, I was in 4-H and was learning all about animal medicine. And I knew at that point it would either be human or animal medicine. It was kind of decided for me when my college scholarship, I had equal scholarships to go to the state school, which had a great veterinary program, or a private small liberal arts college where I would be able to be pre-med. And the scholarship was better at the small private liberal arts college. And I didn't look back. I mean, I still know that there's so much respect for, especially when we talk about regenerative medicine, where so much of it has come along the veterinary path. But yeah, I guess I knew at age 9 I was going to be a doctor.
That's pretty cool. My niece is pre-vet right now. She's super excited for that. I don't think she wants to jump into medicine. She wants to stay with the big animals and do some horse work. So I'm excited for that journey along for her. So I'm glad you made the change that you did in the pivot, I guess, early on, and I'm sure your patients are too. So I do want to ask Dr. Penhollow, how is precision regenerative medicine different from what most people think of as regenerative or stem cell therapy?
Sure. That's a really good one. The biggest misconception is that regenerative medicine is a single product, stem cells or PRP or one injectant, and it's not. Precision regenerative medicine is based on the knowledge that it's not one and done. Outcomes depend on diagnosis. It depends on selecting the right patient, obviously of precisely delivering the right product, but it's also at the right time in the person's life. And really my focus is on optimization. I call it prehab, and that may include anything from detoxing off of a inflammatory diet to making sure that we prehabilitate the muscles and strengthen the spine, the core, the joints before optimizing hormones, optimizing blood work, so that we're then taking a healthy cell, such as the blood for platelet-rich plasma or the bone marrow or even the fat for use in a now anti-inflamed body. Then they're going to get the kind of results that they're expecting and that they're actually paying for. So when people say otherwise, it didn't work. So many people come to me and say, I've already tried that. I've already tried this. What do you have that's different? It's often because the plan was flawed, not their biology.
I like that. So I guess you're taking a functional medicine approach to it as well.
Absolutely. We can't just look at it as I am the collector of cells and precisely placing them back in using ultrasound or fluoro guidance. It's got to be a healthy vessel that receives it.
Yeah. So you made an interesting comment there that, people say that it's been a failure before, and unfortunately some will happen. Nobody's 100% successful. But what do you do to build trust in that patient that said, no, it's been a failure before, it's not going to work? How do you help reverse that thought process that they have?
I listen to them. I listen to exactly what was done. If we can gain the notes, then we're able to go through those together. Good example is a lady's come to me from a very large, well-known academic center nearby, and she shared the notes from 2 platelet-rich plasma injections that she's had in both of her knees, and she also even went so far as to having stem cells in both of her knees. In one of them, they did an adequate blood draw. I was able to see that. They used a fantastic system that concentrates the cells and gets a very high platelet yield, but they mixed the cells with lidocaine, probably because they didn't want it to burn or hurt, because platelet-rich plasma can be a little stingy. But the moment you put lidocaine in with the cells, it kills them. Yeah. So it doesn't matter that they drew the right amount of blood or that they use this fantastic concentrating system. By trying to look out for her and make it not so tender, they killed the cells. In the second instance, they drew a very small amount of blood and put it through a system that is known to have maybe 1/10 the concentrating ability of the previous system, or the system even that I use. And it just means that there was a totally inadequate amount that was used, and that, she got a 1/10 response. Well, she got a 1/10 dose. And we know that there are certain doses that are responsible. So we had that kind of conversation. With the BMAC, very similar. Bone marrow, a volume was drawn, but it was split between 2 knees. And so it was maybe half of the amount or potency that we would have wanted. And in that case, it was not sent off for a specimen to be cultured and then get some results back and talk with her after the fact and say, wow, we only got X number of cells. Kind of no wonder. Maybe the next time we should try Y number of cells, or 2X or 4X or 5X those number of cells. So that's a way that I establish trust, is talking to them, having the knowledge of all the other systems. And the moment I hear X brand, I'll know Y results. And just talking to them about how it's a partnership, that we're not going to be a one and done. I didn't just meet you today, shake your hand and say, hop up on the table, let's draw that blood and get it back into your elbow for your pickleball tomorrow night, because there's so much more to it than that. And oftentimes we're working together for several months. before we even talk about taking the cells. We are preparing for it, but we don't physically take it until we know that the body's going to be the best receptive to it. And that also builds trust, because during those times where we've got several touch points, we're having conversations. I'm asking their questions. I'm allaying their fears. And they can ask me specific things about, well, what about my age, my sex, my comorbidities? What kind of results do you have with that? I share my data with them. I collect my data. I don't just say, well, in general, we have this much % outcome. But you can say, I've had ladies just like you, your age, who are also diabetic. And once we optimize their A1C, I've had an 80% success rate of 80% reduction in pain in 80% of my patients by 4 months. They love that.
That's fantastic. Yeah, it's education sounds like a big part of it, especially as you're stepping it in versus what it sounds other people, maybe practitioners or organizations in the area, are getting them in and getting them out as soon as possible just for that dollar exchange. And that's not how patients should be treated.
It is not. And that erodes trust quickly. And a lot of what I do is repair the trust relationship. And a lot of that is just even in a 60-minute consultation with them, where you're often ushered through the system and being able to just tell your story. The patients know what's wrong. They know what they've been through. You can hear in their voice what they have not been able to say before, or put together before, and you're able to help them become a part of a team where they're also responsible. They've got agency, they've got responsibility on the things that they're going to do, and together we work to get them to where they want to be.
I love it. And I'm sure your patients are very appreciative, especially when they come in and say, I can't believe this wasn't how it was from the beginning. I wish I saw you first. It's a good small compliment at the beginning.
It is. It makes me sad to hear that. So one of my big focuses is education, not only of patients, but also of my peers. I am very fortunate to be on an advisory board, and I do physician education, either one-on-one to 1-on-3, 1-on-4, if we're talking techniques. I do some kind of coaching of other physicians who are looking to bring this into their practice, but the right way. And I figure the more people that we can educate about it, they've got touch point with their patients in their part of the world versus in my part of the world, we can help more people that way.
Yeah. It's a good end goal for the patients, and by helping the provider as well, for everybody to be on the same page as close as possible for best patient outcomes, which is great. So another question for you would be, Dr. Penhollow, how do you decide when regenerative medicine is the right option and sometimes when it is not?
Well, I have a screening process in my head. I know there are certain absolute contraindications. For example, an active infection, it's not the right time now. A history of bone marrow or blood cancer and active chemo, you've got to have an immune system that can mount a response. So even being on things like for psoriatic arthritis or some of the ulcerative colitis or Crohn's, some of those biologics may mean that it's not the right time or not the right time now. Somebody who may be on a blood thinner due to a recent heart attack, stroke, stent in their heart, and they can't come off the blood thinner. That's not good, because many of those blood thinners actually kill the platelets as part of their mechanism of action. And with the platelets come all the growth factors. So it's more of knowing those things. Those are hard and fast. There are others that are a little bit more relative. And that's where I get into the nuance of, are you willing to partner with me? Are you willing to do things like stop eating fast food every meal for, or at least, 5 times a week, 6 times a week, whatever it is? During the period of ramp up, are you able to come off of anti-inflammatories such as naproxen, Motrin, et cetera? Because again, they also poison the platelets. But if you're like, I've been on this drug for 15 years and there's no way I'm coming off of it, then we need to talk about something that is not using your own cells, because you would just be wasting your money. So those are some ways I look at if it's the right time. Another one is being able to say, look, you have bone on bone knee osteoarthritis, and it is unstable because the collateral ligaments, the crossing ligaments, the cruciate ligaments, you are actually feeling like you're going to fall all the time. You're barely being able to stand up. no amount of regenerative medicine is going to be able to reconstruct that. That means you need a surgery. And anybody that tells you otherwise is not being truthful. So there are absolute, I need you to speak with a surgeon, and I'm happy to show you some that I've worked with, and I know that they've got good bedside manner. What do you want to talk about there? Versus others that say, nope, I understand I'm grade 4, but I've got a stable knee and I'll do anything I can. That means partnering with you. That means coming off my alcohol, coming off my NSAID, doing all the things and prehabilitating with you. I want the best shot possible. Tell me my odds ratios, or tell me what it's likely to happen. And unfortunately, we've got some great data on even grade 4 osteoarthritis of the knee, 15, 20 years out, where the patients were their own control. They both knees were grade 4. Both knees could have had replacements. And the people had either bone marrow into the bone of one knee, or they had a replacement of the other knee. And 15 years later, we're still following them. They almost all prefer that bone marrow knee. There have been no infections or really bad contraindications there versus revision after revision after revision. And about a 15% chance in 15 years that you'd go on to have a replacement in that bone marrow knee. That's pretty good. That means 85% chance of not. So we have those kind of conversations, and that's how I determine who's a good candidate and who's not a good candidate.
Okay. I think that second partnering for that patient to take that, it's very hard for people to make a commitment to getting better. It's hard for them to give up food, alcohol consumption, activities, what they've done before. So not only by you sticking to your guns, if you wish, and saying, this is how you're going to get better health through our protocols and our program, they would get it even if they didn't do stem cells. They're going to feel better to begin with.
They
But once
do.
you add those, once you add those services to them having an overall better, healthier outcome and lifestyle, I can only imagine it improves your results.
It does. And I'm the first one to say, a lady came to me and she was in florid perimenopause. Everything ached. She swore that she had frozen shoulders. And that's just a part of, it's a high risk of being in menopause. And she had knees that were hurt. She wasn't able to even hike or do any of these things. We got her on hormones, got those things balanced, and voila. No joint pain, doesn't need her knees taken care of, doesn't need her shoulders taken care of. And I'm happy as a clam for her. I would prefer her to be on a path where she's now protecting her muscle, protecting her bone density, protecting her sanity, protecting her sleep through good hormone modulation through postmenopausal hormone therapy.
Yeah. And the truth is, without saying negative things about other providers, they more than likely wouldn't have taken the time. They wouldn't have sat down with her and listened to her where she's at and said, let's try HRT first, hormone replacement therapy, as an option to see what it does. And it completely changed her life versus go to a provider in a hospital or clinical setting. Sometimes would have just given other medications that didn't help and or went through the injections in the knee that still wouldn't have helped. So, I mean, your approach is fantastic for your patients.
Thank you. I first and foremost, I'm here to serve patients, and I know that this was in her best interest, and that the noise with the perimenopause was so loud, we had to turn that down. We had to take that off the table, or it wouldn't matter how precise the injections were. It wouldn't matter had she changed her eating or sleeping or any of those things. It would not have done the job because she needed hormone modulation.
Yeah. Again, I'm very certain that your patients appreciate how you approach their care, which is fantastic. You kind of mentioned this earlier at the start about it's about long-term care for your patients, but you also spoke about preserving motion, and that's a central approach to how you go about it. Do you mind kind of sharing why it's important long-term for your patients to continue to have better motion?
Sure. I mean, not only for women, obviously, as a woman who was in menopause not long ago and recognized the whole thing about the musculoskeletal syndrome of menopause. Fortunately, there have been a lot of big players in medicine recently who've kind of amplified that. But talking about the risk that women, the moment they start going through perimenopause, we start losing bone mass and bone density. And you think of a woman who falls and breaks her hip, there's a 25% chance that she will not live one more year. There's that much mortality after a hip fracture. So what stabilizes the bones? having dense bones, number one, so exercise to do that, but the muscles stabilize the bones. So muscles are medicine. Motion is medicine. I don't care how many ways you can say it, but all those things are so important that movement is all about that. So even if you've just come to me for a epicondylitis, a lateral epicondylitis, it hurts to do my backhand in tennis or in golf or in pickleball, we need to talk about, well, why did you get there in the first place? Yes, you've got an overuse of the tendon, but what's the alignment that's wrong with that in the first place? Because our body should be able to do that several times a week if it's being stretched, if it's being nourished, if you're doing the right things with regard to warm-ups and cool downs and have good form. So going back to those very basics, it wouldn't matter again if we put the perfect dose in that elbow under ultrasound and use the best kit in the world. If we didn't then correct the thing that created in the first place, you're going to be back or you're going to say it didn't work. So we've got to look at root cause. So herein I go back to that functional medicine where we talk about root cause and examining somebody's stroke, examining somebody's gait, examining somebody as they put themselves through range of motion and looking at fascial patterns and looking at alignment patterns. Is one leg literally longer than the other? And that puts a kind of a curve that the body's compensated in the spine. As you know, as a chiropractor, you know that the spine is everything with regard to holding up the axial skeleton. So motion as the basis of everything. And even if we don't end up working together using your own cells, the focus towards keeping active, keeping moving, getting you back to moving, even if it's walking, even if it's that you're throwing your grandkids in the air, motion is everything. So for preserving lifespan and health span, it's a great first step.
Yeah, you hit it on the head there at the end with lifespan and health span. No matter your age, as you age further, you should want to be able to be as healthy as possible for as long as possible. And again, what a great approach and what you take your patients through.
Thank you.
Yeah. What would you say, Dr. Penhollow, is, or who would your ideal patient be that enters into your practice?
Already active and wants to return to activity, but may have had some little blip in the radar, whether that means that they stopped exercising for a period of time while they were under increased stressors, or they have an actual injury, are active agents in their own life. I'm not into being the paternalistic, do unto me, you are the doctor, you will tell me exactly what to do and when to do it and how to do it. I need a partner in this because this is not magic. It's not anything that I can do by myself, that we have to partner together. So somebody who's into that and who is also recognizing that it's not going to be a quick fix, that it's highly likely that if we're using your own cells, we try to pick a time where you're maybe not in season. I have some things for my in-season athletes, literally, where we'll maybe use prolotherapy, we'll use things like laser or shockwave or mind body aspects of things while we wait for you to have a little bit of time off when we can then use your own cells, because it's going to take a couple months for the repair to undergo itself and us making sure that you're into the rehabilitation portion. So there's prehab, there's the procedure, and there's rehab. So being able to devote some time to their own healing is the ideal patient.
Yeah. So you have a very active care approach to your practice and your patients.
Extremely.
Yeah. Okay. That's fantastic. I know most that are doing this type of work is come in, get the injection, and come back if you need some help. You're taking care of them pre, during, and post. And again, I love it. Love to hear that. Yeah.
Thank you.
Absolutely, Dr. Penhollow. From your practice itself, from the business perspective, what's the focus that you're doing in your business, maybe for growth?
I am resisting this pressure to scale volume instead of quality, because you find that if you are the one doing these things, to include the XYZ adjunctive therapies, that your schedule can fill up and you're thinking, wow, we need more volume. We need to add somebody else that can start doing that as well. And so much easier to say, well, if we had this room with this machine running all day, then we could do XYZ on the bottom line.
Yeah.
It's easier to sell procedures. It's easier to do those kind of things than to build individualized plans. But precision regenerative medicine doesn't scale well if you cut corners. And I simply won't do that. So I'd rather even stay smaller and stay with my fingers in all of this so that I can help ensure the outcomes of my patients. I will be able to let go and say, okay, I've done the first treatment with this one machine, whatever. And while I'm in there, I can also teach somebody to do and make sure that we're having high touch point so that I can help more people, but I don't see me completely turning it over.
Yeah, that's good. I mean, there's nothing wrong with that. It's patient-centric focus care, which is the way it should be. Precision care, which is great. Would you say there are challenges that you have as a business owner?
I think one of the biggest challenges I've had, besides that pressure to scale, would be being able to have somebody that can be on the other end of the phone that's not me when patients are or prospective patients are interested in calling and finding out. And oftentimes the very first question out of their mouth, because they're just going down the line going, how much is your PRP? How much is your PRP? How much is your PRP? And they're just comparing A, B, and C, but it's not possible to compare this practice to a practice that is just a point and shoot kind of practice. So having the ability to train and trust somebody that can answer questions like I do without being the doctor, because that's again the reason to get somebody in to see me is so that they can get the in-depth answers, but so that you can build trust quickly on the phone with somebody who has enough background and enough ability to listen, hear really what the fear is. My fear is you can't help me. My fear is that I'm going to spend all this money and it's going to be for naught. My fear is, right, and turn that into something that gets them on the schedule because they feel comfortable knowing that they're going to be heard and listened to. So that's my biggest challenge.
Yeah. Yeah. Again, business owners in general have a difficult time in healthcare. That trust factor is very, very difficult, especially in private practice like you are versus being inside of a hospital setting where they're kind of feeding you the patients. So again, the approach that you take in your practice is great. I'd love for you to now share. You kind of did with maybe a story or two before, but I'd love for you to share with us a success story that really stands out to you with the patients that you've treated.
Wow. One, I guess, a spine patient who I absolutely adore, had been in and out of the pain clinics and been prescribed no less than 20, 25 different meds from different classes, from antidepressants to nerve meds to anti-inflammatories, to the opioids, and was not interested in remaining on opioids, had done everything shy of the radiofrequency ablation of the nerves to the spine for kind of across the back pain, all these steroid injections, multiple courses of PT, chiro, acu, massage therapy, name it, and he's been there, done that. But when you look at his MRI, it doesn't look that bad, right? It doesn't look horrible. He's in his late 40s. And so you don't have all the degenerative changes, but he did have tears in 2 of the discs because he was so active, because there was an event where literally he did a big, huge lift, felt a rip, and there were rips in the discs, and those had never been addressed. So that had then kind of bound him to the fact where he was not able to stand for X number of minutes, not able to do a lot of different things. So he atrophied, and you could actually see on the MRI something that somebody else had not mentioned. So oftentimes you don't get mention of tears in the discs. Oftentimes you don't get mentioned the kind of atrophy or the replacement of fat in the multifidus muscles. You want to look like a tenderloin. You don't want to look like a New York strip. Right? You don't want Wagyu. You don't want marbling. You don't want that replacement of fat, because the fat is not stabilizing. It cannot hold the bones together and keep them stable as they're doing all this rotating and side bending and twisting. So noting those things, addressing them with an anti-inflammatory diet. We completely detoxed him, and we'd uncovered some things that through a working with a dietitian and in that functional medicine standpoint that he had thought were the healthiest things for him, and he was actually allergic to them. So getting him off of those, he immediately started feeling better, starting to stabilize his core with some FDA authorized tech. He was getting stronger already. So by the time we got to the actual needle-based procedures where we harnessed his own bone marrow, he was ready. And he'd known we'd already been in the room together, probably 10, 12 hours with these treatments. So he knew what to expect, and I'd answered many of his and his wife's questions in multiple different sessions. So we were already partners, and he completely got it. And he was back to doing, we have no bend, lift, twist exercise kind of thing for quite some time after pressurizing the disc and putting your own bone marrow stem cells in the disc. But after 6 months, after the first couple of months, he was actually nothing down into the legs. He had some radiculopathy, but the axial took a little bit longer. And then at the 6-month mark, when I finally released him to do more of the bending, lifting, twisting, he returned back to yoga, which he loved. That was his mental side of things, is kind of zoning and, getting into his body that way. He's just happy. He's so happy, and thought that he would never be able to return to that. So then they're planning trips. They're, playing with the grandkids. They're doing all these things that he didn't think he was going to be able to do, because he identified himself as, I am back pain. I am back pain patient. And we kind of turned his life around.
Yeah. That's a masterclass on taking care of a patient by listening and going through. Not many people, I'll be honest, in my career and what I've done, I work with an orthopedic surgeon in the hospital. They wouldn't take the time to go back through all of that stuff. They just look at what they can see there. And when you talked about how with the multifidus, for those that know, small little tiny stabilizing muscles in the spine, for you to specifically look at that and think about, okay, there's a difference in the tissue sensitivity, probably because of what you see on the MRI. I don't know how many people are going to get that kind of care that you dove into for that patient. So that's just fantastic.
Well, I hope more people get it, because we're teaching it now, that when you address regenerative medicine, it's not a traditional pain as you put the needle right there in that one epidural space, because that's what you get paid for. You get paid to put one needle in there and put this amount of steroid in there, period, end of story. Then you come back some other time and we'll put numbing medicine down on 3 nerves on one side and send you away with a pain diary. When you do regenerative medicine, you treat all this in one setting. 3 discs, 4 facet joints, bilateral. We treated the sacroiliac joints. We treated the multifidus. We treated the ligaments that are then stabilizing all those. One treatment. You've got the cells. You might as well utilize them, because just parsing out and saying it's only this guy, it's only that guy is not correct. These all function together in what we call the functional spinal unit. So with more education going forward, as we're training new docs to bring in to the field and start taking care of more patients, I'm hoping more people get to see it like this and experience it like this.
Yeah, I would hope so too. I really appreciate how you care for your patients. Dr. Penhollow, what's the vision of your business, your practice over the next 3 to 5 years?
Wow. I do need to grow. I do need to be able to help more people. And that's probably bringing a person that can help me be in one room while I'm in another room. I'm not saying it's another physician at this point, but I think that a very strong physician assistant who can do some things that wouldn't require my physical presence in the room at the time. But that would allow me then to be in places teaching and helping precision regenerative medicine becoming the standard about how we treat musculoskeletal care, with earlier interventions, better selection, fewer unnecessary surgeries. The training of the next generation has more impact than me staying in my tiny little clinic in Scottsdale, Arizona. So education as much as treatment, both educating patients, but educating the physicians who are going to be taking care of patients.
Yeah. Yeah. Thanks for sharing that. I'm sure you'll reach that plateau in your business where you're going to need to bring that person in to help. And as you're saying, it's allowing you to go out and educate others to bring their practice up to the level of yours, which I think is great. So as we go to wrap up here, Dr. Penhollow, just a couple of more questions, if you don't mind, but I'll share all of your links so people can reach out to you. But where would you like people to reach out to be able to find out more information about you and your practice?
I have 2. I love having a free YouTube channel, and there are over 400 videos. And so if you are not in the area or can't travel to the area, there's this huge list of resources, and it's everything from what to do for your back pain what if your knee pain hurts when you bend, what are the best exercises for XYZ. How do I put KT tape on my knee if it hurts in the medial aspect, for example? So that's very robust. It also has a podcast. Number 2 would be the website. I've spent a lot of time and effort to make it also educational and kind of give people an idea of the right questions to ask if they're going to consider regenerative medicine. And it is precisionmedprp.com. So the YouTube at Dr. Tammy Penhollow and precisionmedprp.com would be my 2 highest.
Perfect. And I'll share that in the description of all when we share the information of it. So thank you for that. So Last 2 questions. If you could give one piece of advice that would affect everybody's health in a positive way, what would that piece of advice be?
I'm going to have to repeat something we've already talked about because it's that important. Protect your muscle. Muscle is medicine. It stabilizes your joints. It protects the spine. It regulates metabolism. It preserves your independence. If you lose muscle, everything else declines rapidly.
Yeah. Thank you for that education for self and others that are out there. As the year comes around, I think everybody's looking at their New Year's resolutions and what they should be doing as it starts. And, that's great advice that you should give. So my last question for you, Dr. Penhollow. As a guest here on the Prime Health Podcast, what would your definition of Prime Health be?
Prime Health's having the strength, mobility, and resilience to do what matters to you without fear of your body holding you back. It's not about necessarily being pain-free. It is about being capable.
I like that. It's just like everybody's definition of success is unique to ourselves, and that the Prime Health is unique to them as well. So, Dr. Penhollow, you've been an amazing guest. Knowledge from all aspects of how you went into practice, how you changed your mind, how you were practicing. You weren't probably getting the same feel in which it was when you first started going in. And you said, I need to change how I practice. And that changing of how you practice has impacted a lot of lives, which is fantastic to be able to do. So I always ask people that if there's something that you heard, whether you're a clinician or a patient, and there's something that you heard Dr. Penhollow say, please do share it with at least one person. Of course, we would love you to share it with many more, but allow what she has to say and what she can do to impact more people than just those few around our small corners. I always say selfishly, please subscribe to our Prime Health Podcast. We'd love to have more people, listening and joining to us. But until next time, remember that true wellness is always a journey we are on together. So whether you're taking charge of your own health or guiding others in theirs, remember that every step forward matters. So please do stay committed to your Prime Health journey. And again, Dr. Penhollow, thank you so very much for being a guest on the Prime Health Podcast.
It was my honor. Thank you, Dr. Barron.